All right, well, today, more than 7,000 nurses from Mount Sinai Hospital and Montefiore, Bronx, are on strike as they demand for a fair and timely contract that improves patient care. For more on this, we welcome in Michelle Gonzalez, a registered nurse currently on strike at Montefiore in the Bronx. Thank you for joining us today. So we know that there have been some tentative agreements for nurses at other hospitals, Mount Sinai Morningside, Mount Sinai West, that were reached late on Sunday. But how hopeful are you when it comes to Montefiore?
Hi, thank you for having me. We have been working diligently with our negotiating team and with Montefiore at negotiations for the past 3 months. This strike notice and this strike was not an easy thing to come to. We have been trying to negotiate in good faith for the past 3 months, and the strike notice was only placed on the table because our institution does not seem to find the issues that we are bringing to them of any concern. We want better staffing enforcement, and we want more nurses in our hospital to take care of our patients safely and provide the adequate treatments that they need. We are hopefully going to resume bargaining today with our employer. I do hope and I believe that we can come to an agreement, hopefully sooner than rather than later. I don't know when that time will be because it'll depend more on what management is willing to offer. It does appear that over this last 10 days of our strike notice, that they have moved a little bit more in the favor of what we were asking for, which is to reopen some of the closed units that we had closed because our census or our volume was down, meaning we didn't have that many patients. However, now our volume is back up. So we're asking that they reopen that unit and that we stop placing patients in hallways. It's a practice that we don't think is safe for either the patients or for the providers.
And as you mentioned there, it's not just about raising wages, it's also about some of these safe staffing ratios. I mean, if you have patients in hallways and things, it's not safe for staff, it's not safe for the patients as well. Talk about where we are in terms of the conditions at hospitals during the peak of COVID versus now.
Talking about COVID is sometimes like a trauma closet that we don't like to open up. But what happened during COVID has, I think, enlightened many healthcare workers, not just nurses, about our treatment and the level of respect that we receive from our institutions. It's nice when we're called essential workers and called heroes, but it's not nice when we're saying there's a problem in the hospital and nobody's hearing us. Nobody's making any substantive changes. We have an emergency room that is constantly and chronically overcrowded. Patients are struggling to get the care that they deserve. If a patient sticks their foot out of their stretcher, they are in the other person's stretcher.
Goodness. I mean, thank you for shedding some light on the conditions, because for a lot of us on the outside who don't know what's going on inside the hospitals, we do need that insight. We did also hear from Nancy Hagans, the New York State Nurses Association president, saying that there were ridiculously high nursing vacancies. So, I mean, in terms of, was this a problem that was months and months in the coming that just wasn't addressed?
So I think with regards to staffing has been a concern for nurses and for healthcare workers for a long time. And it's not just nurses, it's our respiratory therapists, it's our doctors are struggling with our patient loads. It's not just as nurses. But I think the short staffing affects all of us in the way that when we're trying to provide that care, we're unable to do adequate assessments to give the patients the kind of care and the time that they need.
And so if you had the ear of the mayor or of Governor Hochul, what would you want them to understand about this, given perhaps it does seem to be at least getting a little bit closer, perhaps on some of the demands and the needs?
I invite anyone and everyone to come to my facility in the Bronx. Maybe not right now, because I know that they have reduced the volume to get through this strike, but our normal volume of patients in our emergency room is about 200 at any given time. When you go and walk through this institution and you see patients in the hallway being cleaned, there is a level of indignation that arises in you as a person. And I know it can't just be me. So if anybody wants to come over and see what our conditions are like here in the Bronx, we are inviting them, any politician, to come and take a look at it. And then they can come and make any decisions on how Montefiore can help us get more nurses into this institution.
Well, it's great to hear directly from you there. Michelle Gonzalez, thank you for your time today and best of luck.
Thank you.